Thank you for your interest in coronary artery disease. Before we talk about how blockages in the arteries occur, let's first try to understand the anatomy of the heart. So we will start out with the little arteries that you can see in this diagram that run on the surface of the heart. Even though the heart is filled with blood, it requires these arteries to supply the muscle with oxygen, nutrients, to keep the muscle alive. And it is when these arteries are diseased that we have coronary artery disease. There are three arteries we think about: the left anterior descending artery, the left circumflex artery, and the right coronary artery. Let's see if we can find them on this heart diagram. So the left anterior descending artery is the artery that runs right here. It starts on the aorta, courses down, and then runs right down the middle of the heart. And it has a big branch called the diagonal artery. It is a very important artery, and it supplies the largest part of the heart muscle in most patients. The second artery is the circumflex artery. It also comes off the left main artery that comes off the aorta and then runs here to the side. And its branches are called obtuse marginal. So this one is the lateral artery. And finally, we have the right coronary artery. It comes also off the aorta, runs in the AV groove, and runs down here to the right side and the back part or posterior part of the heart. And these three arteries make up the anatomy of the heart arteries. Once we have coronary artery disease, we speak about a blockage in one of these arteries. So let's assume this artery here up front, it was the left anterior descending artery, has a blockage right here at this spot. If it has a blockage there, it means that this entire muscle that is being fed by this artery is now not getting enough oxygen, not getting enough nutrients. So this is where a patient can develop symptoms. You can think about jaw pain, shortness of breath is very common, exertional fatigue, tiredness, or signs of congestive heart failure, such as lower extremity swelling. So how does this coronary artery disease develop? What is it that makes these arteries block up and cause these symptoms? And what happens in a heart attack? So for that, let's look right inside one of these arteries. Now that we understand the anatomy better of the heart, we will now talk about coronary artery disease. So first let's understand what's happening inside of the artery. So right here in this spot, we have the diagonal artery. Let's assume we can blow up this piece of the artery and look at the three different layers. First, it has the layer called the adventitia, and that's this layer here on the outside. It's almost like a wrapping around the whole artery. Then there is a middle layer, and the middle layer we have in yellow. You see that layer right here, and that layer is the media. Now the media is made out of muscle cells, smooth muscle cells that act like any other muscle in the body. It can contract and make the artery more narrow, or it can relax and widen it. Now the innermost layer is the intima, and that is the layer right here, and that's only one cell layer thick. Sometimes it's also called the endothelium. So there's a cell next to a cell next to a cell, and it is the inner lining of the artery. And then of course inside the artery you have the red blood cells, and they swim around in here. That is a normal artery, and this is a normal artery that contains no plaque. There's no cholesterol in this artery, so it's considered a normal coronary artery. So now let's see what happens if we develop coronary artery disease. Here we have the same artery we just showed you, but I've blown it up a little bit to make the layers stand out a little bit. So the first thing that happens in coronary artery disease is this: toxins. Toxins. What are toxins? Well, toxins are substances that cause damage in our heart. We have tobacco use, that's a really big one, diabetes, that creates a lot of oxidants, high blood pressure, environmental toxins. Let's draw it like a little triangle. These little toxins, they come into the bloodstream and they start to attack this layer, this endothelial layer. And what happens is they start to cause damage in this endothelial layer, and they start to break down the endothelial layer, and they start to weaken the endothelial layer. The body sees we have damage to our endothelial layer here. This is not looking good. Something is happening. It wants to fix the damage. And this is where atherosclerosis begins. So atherosclerosis is toxins coming in and attacking your endothelial layer. That is really the first step. I will take away this toxin layer, and now we'll talk about how the atherosclerosis begins. And for that, we need a couple of more players here. So the toxins we already know. Those guys are well known to us. They were the ones with the triangle. But now come our fatty LDL particles. Here they are. These LDL particles, they are in the blood. They're just small pieces of fat that swim in the blood, and they see this damage. And now they are attracted into this layer just to kind of patch it up. Think of it like spackle. And they start spackling this layer here. They are laying down a layer. And this layer is called a fatty streak. And this fatty streak layer is the beginning of an atherosclerotic lesion. So here we deposit some fat and make a fatty streak. But something happens. The body sees this fat being deposited. It has a special cell called a macrophage. And this macrophage cell, it is actually one of your immune cells. And it sees the damage and sees the fat, and it says there's damage here. This is not good. We want to repair it. So you get an inflammatory reaction. So now these monocytes or macrophages are being pulled into this layer, and they are start to eat all this fat. They eat it all up. And in the process, they become so fatty, full of fat, that they become what we would call a foam cell, because they are so full of fat that they look yellow and full of fat. So these foam cells form all around our fat layer. What happens is that these macrophages, as they fill up with these foam cells, they start to release little substances called cytokines, like little signals. And these little signals go in the blood, but they also go into the middle layer of the artery called the media, right? In the media, we have the smooth muscle cells that we talked about, the smooth muscle cells. And what happens is that these smooth muscle cells now wander into these lesions. They're being attracted by these cytokines. They're being told, come on guys, come in here. You gotta stabilize this lesion. It's full of inflammatory cells, it's full of fat. We gotta fix this. So these smooth muscle cells start entering in, and they start laying a very hard layer of fibrous tissues down to close up this damage. And this is called a fibrous cap. And then this process can repeat itself. So we can have toxins attacking this again, breaking it up, LDL particles coming back in, more monocytes coming back in, and eventually more smooth muscles. And over time, this lesion starts to get bigger. It starts to get bigger, and it is being filled by more fat, more macrophages, so more little fat cells, little LDL fat cells and macrophages. And what we have is atherosclerotic plaque. And then finally, we can get calcium that's in the blood, and that can get into this, and bind with the fat. And now we have calcified fat, or we have a calcified plaque. And this obviously hardens the artery, and this is the process that we call hardening of the arteries and atherosclerotic formation. And as you can see, as this plaque grows, it starts to impinge on the opening, the lumen of the artery. So now our blood has a harder time flowing by. And that is the atherosclerotic lesion that we talk about. Let's talk about a little how this plaque causes chest pain to form. So now we would like to talk about a stenosis. That is usually what you hear about if we perform a heart catheterization or do a nuclear stress test. A stenosis, or a blockage, occurs when this atherosclerotic plaque grows out into the artery and causes the normal blood flow to be impeded. So the blood flow has to go around this blockage. So we talk about a percent blockage, where we compare the opening before the blockage to the opening in the blockage. And if that percent blockage is more than 80%, is when we think symptoms develop. Symptoms such as angina that we talked about before, chest pain, chest pressure, jaw pain, left arm pain, shortness of breath, congestive heart failure symptoms. They can now develop because the blood flow is impeded, and all the heart tissue that is distal to this blockage is now hurting because the blood flow is so compromised across this lesion that not enough blood flow is making it past the lesion, that the muscle tissue that sits past this blockage is not getting enough blood flow. So we try to evaluate this plaque, and there are many different ways that we can evaluate it. So the most common way we do that is a stress test, stress test. There are various forms of stress tests. You can either run on an exercise treadmill, or we can do a nuclear stress test. But what the stress test does, it tries to see, are there any arteries that have an 80% blockage and cause this decrease in flow. And when we do a heart cath, we again look for these severe blockages that impede the blood flow, because that's what we're trying to fix. Now, obviously, you may have blockages that are less than 80% of the heart, and they may not cause symptoms, but they may indicate that this disease is present in your arteries, and that what we need to prevent it. So now what happens when a person gets a heart attack? So when a person gets a heart attack, the first event is that part of this fibrous plaque that has formed, that the smooth muscles have formed on our plaque, gets an acute weakness right here. And what happens next is that our fat cells and our foam cells and the cytokines and all this junk that's in this lesion spills out into the artery. And now you understand why the body was so worried to protect you from it, because this junk that is going into the artery now is very thrombogenic. What does that mean? It means that it can cause blood clots. So the first thing that happens is that little platelets in your blood see this material spill out in the artery, and they activate and they interact with it, and the platelets start to clump and form a platelet clot. and they activate a lot of factors in your blood, and eventually they also cause red blood cells to come along and get sucked into this clot. So now it becomes a complex clot. And when it becomes big enough, it becomes so big that the entire artery is completely blocked. There is no more blood flow past this blockage. So all the heart muscle tissue that is past this blockage is right now not getting any blood whatsoever. And every minute counts because all this heart muscle distal to this blockage now is slowly dying. The patient gets acute chest pain, sweating, shortness of breath, even electrical instability may occur, meaning rhythms may occur like ventricular fibrillation or ventricular tachycardia that may cause the person to pass out or even to die. This is where you have to call 911, you have to go to the hospital, and we acutely put a wire down this artery and try to open up this blockage. But this is what happens in the acute heart attack. A rupture of this innermost layer with the material that's contained in the layer spilling out, and then an acute reaction of your platelets and of your red blood cells to form a clot right at the spot and cause an acute occlusion of the artery, causing you the symptoms of an acute heart attack. So what can we do to prevent this process from happening? Well, the very first thing is obviously that we need to prevent these toxins to stop attacking your inner lining of your heart, arteries. So how do we do that? Well, we want to quit smoking so that the smoking particles don't attack. We want to control our blood pressure. We want to control our diabetes, and we want to engage in regular physical exercise, and we want to eat a diet that is high in antioxidants, and the diet that is usually recommended is the Mediterranean diet. And what does this diet and the healthy lifestyle does? It eliminates these toxins from coming into our body in the first place and attacking our heart lining and starting this process in the first place. That is really the key. The key is prevention of toxins that start the process. Now, some of our patients try their best, but they are diabetics and they have a hard time. So the second process is that we want to reduce the concentration of these LDL particles. So once a person has coronary artery disease, we try to keep the LDL as low as possible, usually less than 60 or 70. LDL level is ideal for patients with coronary disease or diabetes. So we try to reduce the amount of LDL that's swimming in our bloodstream, so there's less LDL that can deposit itself if cell damage in the inner lining occurs. Now, unfortunately, we don't have much that affects the macrophages, and we don't have any real ways to attack the inflammatory response that occurs. Now, antiplatelet agents are important. Many of our patients are on agents that work on the platelets. So aspirin and Plavix are common agents that work on the little platelets that are in the bloodstream so that they become less sticky and are less reactive to any damage in the fibrous cap, and therefore are less likely to form blood clots here. So that's why you often see us give these blood thinners to help with that. But the key to the prevention here is the reduction of toxins. So that's why we always stress the healthy diet, the regular cardiovascular exercise, low body weight, and the Mediterranean diet. I hope you enjoyed this video on coronary artery disease. I have other videos on atrial fibrillation, stress testing, and cardiac catheterization. Please check those out. And until next time.